Good evening. You're watching Left, Right and Centre. The big story that we are tracking, the Home Minister Amit Shah testing positive for COVID-19. He is in hospital. He was present in a meeting of the Union Cabinet at the residence of the Prime Minister, where social distancing, we are told, was maintained. Those who came in contact with Mr Shah have been alerted to the situation and they're looking at their condition also very, very closely indeed. Mr Shah has tweeted on getting the initial symptoms of corona. I got the test done and the report came back positive. My health is fine, but I am being admitted to the hospital on the advice of doctors. I request that all of you who have come in contact with me in the last few days, please isolate yourself and get your tests done, your inquiry done. As the man in charge of the nodal ministry for disaster management, Mr Shah has been busy interacting with chief ministers of states, chalking out strategies for the gradual unlock of India. The BJP President JP Nadda wrote, received news of the Union Home Minister Amit Shah testing COVID-19 positive. I pray to God for a speedy recovery. There have been many other responses from political leaders across the spectrum. Sanket Upadhyay and Akshay Dongre join us now for more on this. Akshay, you're outside the hospital where Amit Shah, the Home Minister, is reported to being treated at the moment. Is there any detail at all that you're getting? When was he brought there?
Well, Vishnu, right now we are outside Medanta Hospital situated in Haryana's Gurugram. What we are getting to know from reports is that Union Home Minister Amit Shah was admitted here at approximately 4 p.m. At around 4 p.m., 4:24 to be precise. As far as the security arrangement is concerned, I would like to show you what exactly is the situation here. At each and every entrance gate of Medanta Hospital, there is presence of Haryana police, which itself is an indication that some high-profile personality is inside the hospital. As of now, the Medanta Hospital has not confirmed whether Home Minister is inside, what exactly is his health condition. But what we can say at this point in time is that, according to reports, he is inside, he is receiving treatment, and a team of doctors is supervising the health condition of Union Home Minister Amit Shah. Also, we saw that how Union Home Minister himself tweeted saying that he had initial symptoms of COVID-19, then he tested positive as far as the report is concerned, and he has asked the people who came in contact with him in the past few days to isolate themselves, to get themselves tested. That itself is a big sign that he is trying to destigmatize this entire COVID-19, the stigma that is attached to it. Also, the man who has been leading from the front, be it the national capital, all the other states, Amit Shah has been the one man who has been leading the fight from the front. So this is definitely a sad news that has come in, that he has been tested positive, but everyone is wishing for his speedy recovery, Vishnu.
All right, Akshay, thanks. Sanket, let me come across to you. The big concern is other ministers, including the Prime Minister, who was present at a meeting of the Union Cabinet at the residence of the Prime Minister. What do we know of that meeting? When did it take place? Who were the senior ministers who were present, in addition to Amit Shah, who was there?
All right. So we do know that on Wednesday, a meeting did take place between the Prime Minister as well as the other members of the Union Cabinet. We know that this was a crucial meeting in which a decision was taken. This decision was regarding the national education policy. This was a meeting in which physically all the key ministers were present, and the entire Union Cabinet was in attendance. So if you ask me specifically, there was the Prime Minister, the top four, and many others who were in fact present. Let's also talk about the other engagements of Mr. Amit Shah. So this meeting on Wednesday, we have learned that post this meeting, no other meeting has taken place in which the Prime Minister and the Home Minister were in attendance together physically. So that is one clarification that has come. Only yesterday, members of or MPs from Bengal met Amit Shah in person, and they've gone on record, including Babul Supriyo, saying that we are also going to isolate ourselves and get ourselves tested probably. He did attend a Lokmanya Tilak function of the ICCR, which was organized by BJP leader Vinay Sahasrabuddhe. There were about 30 to 35 people in attendance, and those people will also be kept under isolation. The Prime Minister's office on its part is trying to tell us, Vishnu, that all possible steps were taken to ensure social distancing. In fact, there's a very strict protocol whenever these meetings take place. There was social distancing, masks, even cars, external cars were not allowed inside the complex. Proper sanitizing was done. But then obviously there does remain a risk of all those people who were in close proximity to the Home Minister. The Home Minister himself has advised everyone to get themselves tested and isolate for the moment.
All right, Sanket and Akshay, thank you both very much for joining us. We're also joined at this stage by Dr. Rajesh Malhotra, Chief of the COVID facility at the All India Institute of Medical Sciences here in Delhi. Dr. Shubhang Singh, a senior medical doctor at Medanta. Also joining us, Nishit Pramanik, the BJP MP. Mr. Pramanik had met Amit Shah yesterday. Well, we can go straight across now to Dr. Rajesh Malhotra. Mr. Malhotra, usually the All India Institute of Medical Sciences is where top leaders actually go to if they fall unwell. In this case, we are told that the Home Minister has been taken to Medanta. Why is that the case?
So, Vishnu, you are asking me something to which I don't have an answer, but what I can definitely say is that the COVID facility which we run at the trauma center is largely for, very sick patients who are definitely needing oxygen and needing ventilator and all. And so I am wishfully and hopefully thinking that possibly it's a way for the minister to sort of isolate himself, but under medical supervision, meaning thereby to me that maybe he doesn't need intensive medical monitoring, which I'm sure still he will be accessible to there. So this is more of a comfort or a choice level, except when it is something which is so specialized that can be done only at All India Institute of Medical Sciences.
All right, that's an important point. Dr. Shubhang Singh, Senior Medical Doctor at Medanta, with us as well. Thanks, Dr. Singh, very much for being with us. We are told that the Home Minister had initial symptoms of COVID. Now, we don't want to get into his personal sort of situation because, there's obviously got the entire issue of confidentiality. But just the broader question of his condition, is he all right by and large? Could you share anything with us?
That I don't have any information about that. So I look at a different facility of Medanta Hospital for COVID patient, not really the patient, the hospital, or somebody, from hospital could give you, or I don't have any idea about that.
So can you tell us a little bit more about the COVID care facilities that you actually have at Medanta? Because from the very onset, we've heard of several cases where, patients were successfully treated. You had all of those tourists when it really started in India, Italian tourists who were brought down. And, there's been a great deal of experience, obviously, which your hospital has gained.
Right. So all the hospitals in India, whether private or government hospitals, are working under ICMR guidelines for the testing and treatment of patients. Usually they have divided, the strategy is early diagnosis and prompt treatment. So in early diagnosis, the focus is on, testing, testing, tracking and treating. So you have to test more and more people who have symptoms or who have come in contact with any positive patient, then treat them and obviously track all the contacts. So that is the strategy by ICMR, and it's very, very important strategy to control this pandemic. And then obviously hospitals like, Medanta and other pioneer institutions in the country are having the tertiary care facilities, and they also run different programs of home care facility for the patient, where you could, when they are at home and they are COVID positive, and some patients can be admitted at hotel isolation also, so that, the medical teams can monitor their vitals and danger signs. Some patients who are, diabetic, hypertensive, heart disease patients, or who have other past medical, they should be by medical experts, which is very, very important.
All right. Dr. Malhotra, let me come back to you. It's basic protocol that if you have come in contact with somebody who's unwell, tested positive for COVID, then you need to actually segregate yourself, potentially get yourself tested. What are some of the precautions that those who came in contact with Mr. Amit Shah need to be taking?
So Vishnu, this is a very important thing. So here we have to see what contact means.
Yeah.
But we know that if there is a social distancing and everybody is wearing a mask, and that's a very important social message here, that if you wear mask, everybody is wearing a mask and there's a social distancing, the risk of infection is really very low. Having said that, if you have come in contact with the person, you are likely to become positive any day between 5th day and 12th day. So that's the incubation period. So if I come in contact with you today, suppose I was in the studio and I got infection from somebody in the studio, I won't test positive maybe till 5 days. So that is a period which is actually most crucial. So there's always this thing about what is the best time to get a person tested. So I will say it's definitely not before 5 days. So you isolate yourself, separate, get yourself tested after 5 days. And I think if you are negative by 5th day and you haven't developed any symptoms, I think you are pretty okay. Important thing is the day you develop symptoms, you have possibly been highly infective 2 days before and 2 days after. So people who have been hiding in their houses when they got symptoms, wearing the COVID, going for a test more than 2 days after the onset of symptoms, the possibility of testing positive keeps becoming low, and it would almost become negligible about 10 days after this in most of the cases.
Dr. Shubhang Singh, when one talks about the onset of the illness itself, obviously different patients, we are all different people and circumstances, but by and large, in your experience, over the last several months, what are some of the earliest symptoms that you actually see when you know that, yes, this appears to be, it appears to be going down the route of COVID and not necessarily a cold and a cough?
Yeah, so initially, most of the patients having their living history, but now,
Doctor, we'll come back to you in a moment. The line is bad with you, but I'll put that question across to Dr. Malhotra.
Yeah. So Vishnu, that's a great thing. You said something about symptoms. Now there lies the whole complexity, because we know that almost as many as 80% patients have those symptoms. So that is the reason why we are still getting patients, because if we were only worried about those who have symptoms, we would have much less load of the disease. The problem is that there are a lot of people, maybe, in media, maybe in people around the VIPs who are going around who have no symptoms. So our problem arises because most of the patients have no symptoms. Now, if it comes about the symptoms, we know that this disease can mimic anything. So it could be fever or running nose or cough or breathlessness, but we know that it could be loss of taste, loss of smell. Everybody in India, I know, knows about those symptoms. But what is more important is the unusual symptoms. We have had patients, diarrhea has become a common symptom now, but we have had patients coming with, a red eye or a bleeding in the eye or a stroke or a cardiac event. Those are the things which are very difficult to diagnose, and even for that matter, say definitely that whether it was a corona leading to a stroke or a cardiac event, or a person with a cardiac event or stroke testing positive for corona. But I think our main concern is the asymptomatic people, which is the majority, and that's where it is beating us. It has been actually putting us on the defensive.
Dr. Singh, is that what that you've also experienced? Over a period of time, we've come to learn that people who are COVID positive can have a very, very wide range of symptoms. It's not just a cold and cough, an irritation in the throat, or a breathing distress. It could essentially be almost anything. Is that what you have experienced as a doctor, as a practicing doctor?
Yes, as a practicing doctor and with a keen interest in the public health, it's like a subcontinent people are living. So obviously in different geographical locations, clinical features, the pattern differs. Dr. Malhotra has very rightly explained that, some patients like the younger, like loss of smell and loss of taste, or maybe mild body ache, or they have just initially 1 or 2 days and now they are fine, or maybe mild sore throat. So related to that, one should be tested. That's why Government of India has designed this strategy to test more and more people who show symptoms or who are in contact with any position treat all of them and track all the contacts so that it can't spread in the community.
Dr. Malhotra, isn't that the central issue over here? We keep talking about testing, but correct me if I'm not correct, but between rapid antigen tests and the other test, which is so much more accurate, people rely initially on rapid antigen tests, particularly in places like Delhi, and if you are asymptomatic, then you are told that you don't necessarily have to go to an RT-PCR test. And you, as somebody, you mentioned it, you hit the nail on the head, that there are so many people walking around with no symptoms at all. So therefore, if I have come in contact with somebody who is potentially who is a COVID patient, but I have absolutely no symptoms, I go through a rapid antigen test, there is a false negative, but because I have no symptoms, I am not put through an RT-PCR test. Isn't that a real problem, not just in Delhi, but in other parts of India?
This time, Vishnu, you are the one who has hit the nail on the head. But first, I'll just quickly address the symptoms. So another interesting thing I've seen about the symptoms is that in a particular family, the disease very often I've seen follows the same trend, whether it's because of the same strain of the virus along with the same genetic predisposition of the family. So if one person in the family had COVID and had fever for 12 or 13 days, it's likely that the other members, when they get symptoms, they'll get a prolonged fever much longer than the usual. Now, coming to the test, now let me be very frank, you have absolutely like I said earlier, hit the nail on the head. Now, those cases which are asymptomatic, if you want to pick them up, I will say that RT-PCR is the test to go, because when you have a low viral load, the rapid antigen test is not the test to go for. I will use rapid antigen test because we cannot possibly do RT-PCR on everybody in the community. But if somebody comes with the symptom, florid symptoms, I'm very sure that this guy, he looks to me that he is positive. I will like to do an RT-PCR because that's where it will give me worth for my dollar. I'll do an RT-PCR there. But if, in spite of a very high suspicion, I find that I'll go for rapid antigen. If the rapid antigen test is negative, I will still go ahead and do an RT-PCR if my index of suspicion is high. But doing rapid antigen on asymptomatic patients is a waste. You have said that a very high percentage of them will test negative, which is what our experience is. So if I want to check a person who's asymptomatic, I would highly recommend only RT-PCR and not rapid antigen. So if I have a patient who has come for surgery, he has to be admitted to the ward, and I cannot take a risk of the whole ward getting infected. He is asymptomatic. I need to take him to operation theatre and operate on him. I'll do an RT-PCR and not a rapid antigen because of, like you said, a high risk of false negatives in these
right. Well, we're also joined by Mr. Arjun Singh. He's a BJP MP from Bengal. Mr. Singh, thank you very much for being with us. Singh साहब, कल आप अमित शाह जी से मिले तो आपको इस वक्त बताया गया कि आप आइसोलेशन में जाइए, आपको डॉक्टर्स की क्या एडवाइस है, क्या सलाह है?
नहीं, ऐसा है कि हम लोगों ने जब अध्यक्ष थे हमारे जो अमित शाह जी होम मिनिस्टर हैं, जब हम लोग मिले थे हम लोग माने पूरा सोशल डिस्टेंस मेंटेन करके ही हम लोग मिले थे और उनका कोविड पॉजिटिव निकला है। और हम लोग दुआ करेंगे भगवान से कि जल्द से जल्द वो ठीक हो जाएं और फिर से देश की सेवा में लगेंगे। देश उनका हमेशा से इंतजार कर रहा है कि जल्द से जल्द वो सब लोग दुआ कर रहे हैं तो जल्द से जल्द ठीक हो जाए।
और अर्जुन जी, आप अकेले थे जब आप अमित जी से मिले या आपके साथ और भी लोग थे जो मिले थे? और ये उनके ऑफिस में था ये मीटिंग?
हाँ, कई लोग थे उनके ऑफिस में। हम लोग पूरा सोशल डिस्टेंसिंग मेंटेन करके मिले हैं, कोई दिक्कत नहीं है। और
उस वक्त अमित जी ठीक थे, मतलब उनका तबीयत ठीक था?
एकदम ठीक थे, हम लोग से अच्छे ढंग से मिले, बातचीत जो हम लोग जो बात करने के लिए अच्छे ढंग से मिले।
जी अर्जुन जी, सिर्फ एक और सवाल आपसे, डॉक्टर्स ने आपको आइसोलेशन में या प्रिकॉशन लेने के बारे में कुछ नहीं कहा?
नहीं, हमने डॉक्टर को दिखाया भी था, ऐसा कुछ भी हमारे पास कोई सिम्टम भी नहीं है। मेरा टेम्परेचर से लेकर सब कुछ ऑन द वे है, ऑन द लाइन है, कोई दिक्कत नहीं।
तो आप मतलब कोई रैपिड एंटीजन टेस्ट या RT-PCR टेस्ट नहीं करेंगे?
नहीं कर लेंगे, उसमें कोई दिक्कत नहीं है। कोई प्रॉब्लम हमें होगा तो मैं तुरंत कर लूंगा।
प्रॉब्लम होने के पहले आप नहीं करेंगे?
कोई प्रॉब्लम नहीं है, आप टेस्ट करने के लिए कोई जरूरत महसूस नहीं कर रहा हूँ, तो क्या उसमें करना है।
All right. BJP MP Arjun Singh, thank you very much for speaking to us. One of the leaders of the BJP who'd met the Home Minister yesterday in his office along with others, saying that he won't do a test if it's unnecessary. He won't necessarily do a test unless there are some symptoms which become evident. Social distancing, he says, was being maintained. It raises interesting points. If you come in contact with somebody who is COVID positive, then are you not bound to test yourself or others to see if you have picked up the infection or not? It does raise important questions. But just briefly, what Amit Shah tweeted earlier today on getting the preliminary symptoms of corona. I got the test done and the report came back positive. My health is fine, but I am being admitted to the hospital on the advice of doctors. I request that all of you who have come in contact with me in the last few days, please isolate yourself and get your inquiry done.